February is Heart Health Month, a time of year dedicated to raising awareness about heart health. Channel 3 Eyewitness News reporter Eva Zamaris introduces us to a man whose near-death experience turned into a mission to help others.
I was a 17-year-old kid, athlete, training at a really high level.
That's why Mike Papali says they couldn't have predicted what happened next.
I was working at my dad's basketball camp in Wallingford, and I was sitting on the bleachers, and I went into cardiac arrest.
Someone jumped into action, giving Mike CPR before he was rushed to the hospital.
They put me through a variety of tests to diagnose me with hypertrophic cardiomyopathy, which was just a huge surprise to my family and me. We never thought that a young person that looked very healthy could possibly have something wrong with their heart.
Mike says they implanted a defibrillator into his chest, and he takes a beta blocker twice a day.
It was definitely a recovery, and it took time for me to kind of figure out how to navigate my life and how to live my life.
Mike says he's living a normal, healthy life.
As scary as it might be to find out that you have heart disease, they're manageable conditions. They might impact certain parts of your life, but having knowledge of the disease's power.
Dr. Travis Hinson first met Mike when he came to the cardiovascular genetics clinic at UConn Health.
I want you to take some deep breaths for me.
There, they treat patients who've already been diagnosed with the genetic cardiovascular condition, or those whose family history shows a higher risk of developing cardiovascular diseases.
We can use the genetic testing to find their risk and then screen even younger people in the family. We can use that genetic information to find who else is at risk for those kinds of problems and try to identify those patients early and do treatments to prevent that.
Dr. Hinson says they can then come up with an individualized plan.
We call that personalized or precision medicine, and as opposed to, giving everyone the same medication no matter what their potential risk is.
Through testing, Mike found out his dad also has a condition.
I had no idea until, they diagnosed me.
Mike's mission is to spread awareness and do what he can to help. He started his own foundation in a heartbeat.
We donate AEDs, we provide CPR and AED training. We write checks for research projects that specifically support hypertrophic cardiomyopathy. And we're actually, this May, we're starting a cardiac screening program where we're going to be giving free EKGs to children, teens, and young adults throughout the state of Connecticut.
He's hoping through this screening program they'll be able to
detect some of these conditions before someone needs CPR and an AED to survive.
In Farmington, Eva Zamaris, Channel 3 Eyewitness News.